Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
When you hear about bacteria, you probably think of something bad, something that causes an infection, and that's certainly true. But there is more to the bacteria story than just an infection.
The rest of the story.
That's right. Now, the truth is that our intestines are full of both good and bad bacteria all the time, 24/7. Probiotics are the so-called good bacteria that may promote a healthy immune system and improve some common health problems in adults like irritable bowel syndrome, diarrhea, or constipation.
While we know probiotics can be helpful for adults, what about children? Recently, researchers have been looking at whether probiotics could be beneficial to babies born prematurely or even for healthy infants. Here to discuss babies and probiotics is Mayo Clinic pediatrician Dr. Bob Jacobson. Welcome back to the program, Dr. Jacobson. It's good to see you.
Thanks for having me.
Tell us, why all the hype over probiotics? I mean, why mess with Mother Nature?
Well, that's a great question, and we've got to be very careful here. You're right. Probiotics are the friendly bacteria that live in and among us and make us healthier. We know that. Science shows that the probiotics that naturally occur in us do good things. But that doesn't automatically mean that we should buy something that says it has probiotics in it, or that we should purposely buy a supplement because it has a probiotic. In fact, the answer to that should be no, we shouldn't, for several reasons. One, we don't have good evidence that taking probiotics on purpose does any good. Probiotics in this country and in other countries are sold as food supplements and aren't regulated. That means the Food and Drug Administration is not confirming with scientific proof that they're safe or effective. They're not being licensed like drug or vaccines. And we then don't have continued monitoring of their manufacture to make sure they have in it what they say they do on the label and that they're safe. In fact, organizations like Mayo Clinic and other healthcare organizations that conduct research uncover associations with food supplements, vitamins, and minerals that go unregulated as a source of many adverse events. We think about 50,000 are reported every year in this country with these materials such as vitamins, drugs, and probiotics. So I advise my parents and my patients not to purchase probiotics, not to take them. Instead, they should nurture their natural probiotics by eating a wide variety of healthy foods regularly, taking good care of their bodies that contain the probiotics that help them naturally.
Isn't part of the situation here, though, kind of the things that we know, that if you take too much antibiotics, that can be harmful to a child or to an adult? And so I can see how people are starting to kind of construct this together because of what we learn.
I understand that. When I prescribe antibiotics for a condition, I first of all make sure they have a condition that benefits from antibiotics, and secondly, that condition actually needs the antibiotics to resolve quickly. We found over the years, and Mayo Clinic is a good practitioner of this now, that most children 2 years and older actually don't need antibiotics for their ear infections.
It's viral. It's viral.
Well, actually, many times it's bacterial. And yet the child
so,
can resolve the infection without antibiotics. So we're taking steps to avoid antibiotics because of a concern that would dampen the health of the probiotics. But that doesn't mean you automatically should go to the store and buy something that someone claims contains probiotics and take it to restore, because we have no proof that works. And we have some evidence that it is not safe. And what's concerning about this is, at least with the antibiotics, they've gone through the licensure process to prove the safety and efficacy at the doses prescribed. But no one has done that with the probiotics. You don't even know what dose you're getting, despite what's on the label, because it's not regulated like a drug or vaccine. So in fact, I would say it's different from taking antibiotics. They aren't the opposite of antibiotics. Antibiotics are a well-regulated drug used for very specific purposes. Probiotics are regulated like food supplements. And that means not very regulated at all. And that's why my partners and that's why experts across the country say no probiotics as supplements.
So it's something that is being studied. I mean, it's someday we might have the answer to that.
Oh, yes. And in fact, researchers, when they study probiotics in their administration, can, in their laboratory, regulate what they're giving, and they know the dose they're giving, and they know the conditions. But that doesn't mean it's replicable, or just some other company says, I'm now going to sell probiotics mirroring that study. No agency is confirming that manufacturer is actually delivering the right product in an ongoing way. Indeed, with vitamin and mineral manufacture in this country, investigations have even found rodent feces and rat hairs in the products. They're that unregulated. Only a few companies volunteer to have their products carefully monitored. And one has to look far and wide to find a vitamin or mineral that meets the standards that we demand for our drugs and vaccines. I would argue that everything that we recommend for treatment or prevention should have the same level of evidence and the same level of regulation.
What is the study about premature babies that brought you in with us today?
Well, there are studies where they can, with supplements that are carefully crafted and monitored, give it to a premature baby who, being born premature, is at risk for gut injury, helping to create a probiotic flora in the gut and prevent necrotizing enterocolitis and other calamities of prematurity. This is very promising stuff, but it's not ready for prime time. It certainly means, it doesn't mean that our patients should rush out and start taking probiotics because researchers in a very carefully lab-defined situation found some good. It takes up to 17 years for laboratories to bring a product to licensure by the FDA. And the problem we have with probiotics in this country is that manufacturers can do end runs around that, skip the scientific investigations proving that they're effective, proving that they're safe, and then put them on the market as food supplements, and then go on manufacturing without any regulation. Well, let's think about it. Here we have an unmanufactured product that contains purportedly living bacteria.
Right.
How do we know the bacteria have not been contaminated with another bacteria, fungus, and is actually going to be given to a child who has immune compromising condition or is on a medicine that lowers that child's ability to make stomach acids, such as used with Prilosec or Protonix or similar drugs? That child's at risk to get a gastrointestinal infection on purpose, given by the supplement. In an unregulated market, we put our children at risk. We put our adults at risk too.
I really like the way Dr. Jacobson thinks. So a lot of false claims out there about probiotics, and you do not recommend them.
Correct.
All right, we've been talking about probiotics for children and infants with Mayo Clinic pediatrician Dr. Bob Jacobson. Thanks so much for being here.
Thank you for having me.